Miscarriage information for women in Utah County. Very few things in life are more painful and heart-wrenching than losing a much-wanted pregnancy. Many women suffer great emotional distress and grief, as well as debilitating depression after a devastating loss or miscarriage. The good news is that most pregnancy losses are sporadic and not repetitive. Recurrent pregnancy loss, or RPL, is defined as 2 consecutive miscarriages in a row. Genes can play a role in miscarriages. Research has shown that the vast majority of losses in the first trimester are due to abnormal chromosomes in the developing fetus. That is, 60 to 70% of miscarriages occur because of abnormal chromosomes, which are usually either missing or extra. The most common include the trisomes 13, 18, and 21. Turner syndrome, which is an XO, or when a sex chromosome is missing, is also very common. About 5% of patients who suffer from RPL have a gene translocation in which part of one chromosome is attached to the wrong chromosome. To diagnose this disorder requires special, extensive testing of the parent's chromosomes and therefore is rarely performed except in parents with multiple losses. So let's look at other options. Is age causing your recurrent pregnancy loss? Age is also a very common factor in RPL. The older a woman is, the more likely she is to miscarry. More than 1 out of 3 women over 35 will have their pregnancy end in spontaneous abortion. Therefore, it is important not to let the biological clock tick too long before attempting to conceive. Luteal phase defect, or a lack of adequate progesterone production by the corpus luteum, has also been theorized to play a role in RPL. Theory suggests that the corpus luteum fails to produce adequate progesterone to maintain a viable pregnancy. Dr. Saunders treats women with multiple losses with progesterone either with vaginal suppositories, injections, or pills to try to prevent recurrent miscarriages. There is no downside to this, and thus most OBGYNs will treat it. Let's look at some diagnosis and treatment options and see how Dr. Saunders, your Orem OBGYN, can help. Metabolic disorders such as hypothyroidism, hyperthyroidism, or uncontrolled diabetes have all been shown to increase the chance of miscarriage. An autoimmune disorder called antiphospholipid syndrome may be the cause of spontaneous abortion in between 3 to 5% of patients with recurrent pregnancy loss. Heparin or aspirin has also been used to treat this disorder. In fact, a recently published study presented at the annual meeting of the Society for Maternal and Fetal Medicine in San Francisco demonstrated an overall increase rate of 9.2% live births in women treated with a baby aspirin after previous loss prior to 20 weeks in the past year. One last positive note is that approximately 70% of couples with RPL will achieve a successful live birth within their next pregnancy. For more information on recurrent pregnancy loss and many other women's health questions, contact Dr. Saunders, Obstetrics and Gynecology at 801-692-1429 or visit our website at www.drsaundersobgyn.com.